septic مواد تعقيم للهاند. Okay. Started this examination. We'll take the concept from started this examination from the end of the bed. First of all, I'm looking for the movement of the abdomen, any abnormal movement, any abnormal pulsation at the end of the bed. Then I will kneeling, okay? I'm looking for pulsations, epigastric pulsation. If there's abnormal pulsation or normal from aorta, I'm looking for any movement during examination. And in localized peritonitis, you have to decrease movement from side, okay? We should looking also by inspection any hidden area. If there's looking for scar, dilated veins, okay, any bulging, any pulsatile mass, okay. This is by an inspection. By palpation, you have to start superficial palpation. Superficial palpation. Before you start, you ask the patient for the pain. ما عندك أوجاع في منطقة معينة. إذا عند pain, إذا the patient have the pain, you have to avoid the side of the pain. Okay. We started by just superficial examination. Okay. I'm looking for superficial mass, superficial tenderness. I always looking for the patient eye for any feel grimace, the signs of the pain. Okay. If in superficial examination, if I feel mass, you have to what's called bending test. يعني تقدر تقعد وأنا أخليك. Okay. This is I'm stressed on the patient to if there is mass, bulging, superficial mass or deep bulging. By this test, bulging the mass. Okay, this is superficial palpation. I'm start also deep palpation. I'm looking deeply for any mass. Okay. Also, I palpate for aortic examination of aortic. Okay, para-aortic lymph node. Para-aortic lymph node. Also, I'm looking for any hernia. Okay. والله تقدر تقول pulsations of the femoral pulsation. Okay, if there's abnormal femoral pulsation or not. Then I will go for organs. I will examine for organs. We have spleen and liver. First of all, we have to start in spleen. Spleen, if I feel any mass, you have to start from right iliac fossa and with inspiration. After each breathing, I start 1 cm push. خذ نفس. I don't feel any spleen. Okay. We can mix the palpation with percussion sometimes, but I will postpone percussion. خذ نفس. Yes. Palpate the liver. You should started by measuring the liver, looking for liver span. It is very important, liver span. This is liver span. It is more than, it is normally, it is 8 to 12. If it is less than 8, it is cirrhosis. Less than 12, that means hepatomegaly. You should be looking for the span. And then I am looking for the kidney. Kidney palpation. طلع النفس يفضل بالإكسبيريشن. Okay. There is no enlargement of the kidney. Okay. Also, I'm looking for the bladder. Always the students is bladder, if there is full bladder or not. Okay. Then I move to the percussion. Percussion, I will. There is methods for examination of the spleen percussion. There is general percussion on the side of the spleen, and there's a specific 3 signs of percussion. The sensitivity of this signs is 75% reduction of spleen. I'll talk shortly. First of all, I'm looking for what's called Castle method. Castle method at the 8 and the intercostal space. I put, take a breath. خذ نفس واقطع. خذ نفس واقطع. This, yes. If turn dullness, that's mean spleen. First castle. Nexium. Nixon. There's Nixon method also. Trops triangle 6 intercostal space. Okay. And mid-axillary line and also intercostal. This is the imaginary triangular space. I will do percussion from medial to lateral in this space. If there is dullness, indicates spleen. Third, here Nixon methods. It is a posterior axillary. You have to looking for how much the dullness. You have to calculate dullness more than 7 to 8 is considered splenomegaly. This is 3 method for spleen, and also for the liver span. And just you should looking. Also you have to percuss for the bladder. The last percussion, it is for ascites. Ascites we have shifting dullness, transmitted throat. Primary shifting dullness, عادة shifting dullness we do from the midline after a few seconds. Okay. Okay, this is shifting dullness, transmitted throat. We can put citrus on the midline by this, and also we do this method for any transmitted of the throat, detecting ascites more than 1000. After من ألف no detect ascites, while the shifting dullness detect any ascites more than 250 no. Okay. Also after we finish the percussion, I'm looking for you have looking for any auscultation. Auscultation, we have put stethoscope here for right iliac fossa, any for bowel sound, number 1. Second, 2 cm lateral, 2 cm above. This is site of the renal artery stenosis. Okay. Proid for renal artery stenosis, any proid. Also, we auscultate above the spleen for perisplenitis and hum. Also, auscultate above the liver. I'm looking for the bruit and the hepatoma, alcoholic cirrhosis. Also, venous hum and portal hypertension. Okay. Also, the lastly, I will go for sometime we go lastly for pistol shot. Any femoral pulsation, we put this scope on pistol shot. If the examiner told the students, if you complete, not complete, we have do succussion splash. This is need request from examiner, and also we PR examination. Also should student take a request from examiner. This is the abdominal examination. Thank you very much.